Welcome to Cardio Radio, a podcast of the Ohio Cardiovascular and Diabetes Health Collaborative, also known as Cardio. This is Dr. Michael Constant from the Case Western Reserve University School of Medicine, and I serve as the principal investigator for Cardio, a statewide network of Ohio's 7 medical schools. Cardio is funded by the Ohio Department of Medicaid and shares best practices to improve cardiovascular health, diabetes outcomes, and to eliminate health disparities in Ohio's Medicaid population. The opinions and recommendations in this podcast are those of the presenters and not those of Cardio and its sponsors, and are not intended to be a substitute for medical advice. I hope you enjoyed today's podcast.
Hello, I'm Dr. Austin Fredrickson, an internal medicine physician at Northeast Ohio Medical University and a member of Cardio's Team Best Practices. Today, we are exploring the topic of food and nutrition insecurity and how it impacts our patients with diabetes and cardiovascular disease, a vital issue for both patients and clinicians throughout Ohio and beyond. In this podcast, we'll discuss how to screen for food and nutrition insecurity and why it is important, practical strategies to help clinicians address food and nutrition insecurity in their communities, and ways to collaborate with community organizations and food banks to improve health outcomes. With me today are 2 very special guests from the Greater Cleveland Food Bank. We have Eric Pecherkiewicz, the Greater Cleveland Food Bank's Nutrition Manager, and Kristen Mikelbank, the Senior Manager of Research and Program Evaluation. Welcome to you both.
Thanks for having us, Austin.
Hi, thanks for having us today.
Let's kick things off by defining food insecurity in practical terms. What is it? And how does it relate to nutrition insecurity, especially for patients with diabetes or hypertension?
Food insecurity is the uncertainty or inability to obtain enough food due to cost or other resource constraints. And that focuses on the availability of the food, whereas nutrition security, by contrast, stresses the importance of the food quality for health. Approximately 14% of U.S. households back in 2023 reported food insecurity. That was an increase from the previous year. That's the latest data that we have on that. So for instance, patients with diabetes who are food insecure, they're often going to rely on more affordable calorie-dense foods, which can negatively impact their blood glucose levels. And these foods also tend to be high in sodium, which can increase hypertension.
Thank you, Eric. That's really useful information. And now we know what we're talking about. Food insecurity is not necessarily the same as nutrition insecurity. You can have enough food, but not have it meet the nutritional needs that you require for your health. Kristen, who do you see impacted by food insecurity, and how big of a problem is it for us in Ohio?
Really, anybody can be impacted by food insecurity. The main drivers of food insecurity are related to employment, housing, and healthcare. For people who are unemployed or underemployed or earning lower wages, they are more likely to be food insecure. Sometimes when people have high living expenses around things like housing, healthcare, maybe utilities or childcare, they have less resources available to pay for food. So that can contribute to food insecurity. People might also have trouble accessing food because of a lack of transportation or a lack of nearby grocery stores. Based on some recently released food insecurity estimates from Feeding America, 15% of Ohioans are food insecure. So that is more than 1 in 7 Ohio residents who are facing food insecurity. For Black people living in Ohio, food insecurity is even higher at 31%. For the Hispanic population, food insecurity is 26%, and child food insecurity in Ohio is 20%. Nationwide, 86% of the counties with the highest food insecurity are rural. So food insecurity is disproportionately affecting communities of color, children, and rural communities.
Wow, those are really eye-opening statistics. It's hard to think about. If you're seeing 20 or 30 patients a day, that's a handful of patients every single day that come across that are going to be dealing with food and nutrition insecurity. Or if you put that into your child or grandchild's classroom, there's students sitting next to that child every day that aren't getting enough food that they need. What are you hearing at the food pantries about your clients and their families in terms of the health conditions that they're facing?
Yeah, so not having reliable access to food or to the appropriate food can really make it difficult for people to manage their health conditions. So recently, the Ohio Association of Food Banks conducted a study that asked people for input that were coming to Ohio food pantries and produce distributions across the state. And what we found from that work was that 59% of people that responded to the survey reported at least one person in their household had a chronic health condition. So 24% of respondents said that someone in their household had diabetes. 35% said someone in their household had high blood pressure or hypertension. And about 12% of people who responded said that someone in their household had heart disease or had had a stroke. And unfortunately, more than half of the people who were visiting the pantries and produce distributions had to make choices between paying for food or paying for medical care. And for the people who were making those choices, about a quarter had to make those choices every month or every other month. For a lot of people, they're having to make difficult choices way too often.
So, if you're confronting patients who are choosing between their medicines and their food, where do you realistically start? Where do you advise clinicians to begin?
One of the key things that the Greater Cleveland Food Bank has been doing is having our partners, like healthcare systems, screen patients for food insecurity. We use a 2-item hunger vital sign survey. That is, within the past 12 months, we worried about whether we'd run out of food before we got money to buy more. And within the past 12 months, the food we bought just didn't last and we didn't have money to buy more. Clinicians can also screen for nutrition security with this item. In the last 12 months, we worried that the food we were able to eat would hurt our health and well-being.
Wow. And many of our electronic health records as physicians have similar questions embedded already. So you need to make sure you know how to access that. Where do you find it? Is it part of the questionnaires? Is it something that rooming staff are able to do? Is it part of the social drivers of health section? Further, you can actually code ICD 10 Z59.41, which says food insecurity in and of itself. And you can put that on patients' problem lists. By having that as an active problem, it can remind us when we're seeing patients who are having issues that food insecurity or nutritional insecurity could be at play. It can be helpful at a patient level and also as a population level to have that information there. Eric, what other resources would you recommend?
We have a variety of resources. So, for instance, local food banks can often connect people not only with pantries, hot meals, produce distributions, etc., in their area. They can often help people find out if they're eligible for SNAP or WIC. If so, they can sometimes help people sign up for those programs. Some areas have food prescription programs in partnership with healthcare systems. A lot of food banks are turning to a food as medicine approach. We can have healthcare systems hosting pantries on site, distributing produce on a monthly basis to their community. And a basic resource is My Plate. Our government has provided data. Last I saw, the vast majority of Americans weren't eating enough servings of the 5 food groups regularly. So when you think about that, if nutrition can impact your health condition, getting to that is a good basic first step. Before we see if that doesn't improve your health, then we can look at more specific nutrition advice.
I love that, Eric. And it's not just about pulling out sugar and salt. It's about making sure you have enough of the healthy, nutritious foods available to you. I think that's really useful.
Yeah.
I'll note for the listeners that we have several resources related to this topic, and we're going to drop those in the show notes. And it helps remind us that there are resources available, just like you said, Eric. Kristen, what do you say to clinicians who feel like they just still have to take on this issue alone?
The clinicians definitely don't have to do this alone. Patients might feel more comfortable talking to their healthcare professional, but social workers, dietitians, patient navigators are all there to help connect people to food assistance programs. There are 12 food banks in Ohio that are here to help. They serve every county in the state. The Ohio Association of Food Banks, if you visit their website, ohiofoodbanks.org, that can direct people to their particular food bank. And then once people find their food bank, they're directed to resources that are within their own community. As Eric mentioned, the Greater Cleveland Food Bank also has a help center. We serve 6 counties at the Greater Cleveland Food Bank: Ashland, Ashtabula, Cuyahoga, Geauga, Lake, and Richland counties. So by calling our help center number, our staff that work in the help center can direct people to food assistance resources in the communities where they live or where they work. And they can also help them sign up for public benefits if they are eligible to do that. And really, anyone in the state could call our help center if that's an easier way to find resources for the patients that people are seeing or working with. And we'll be happy to, direct people to their nearest food bank or provide them information with how to get in touch with their nearest food bank. And sometimes there are events happening in the community events where food resources are shared or where food resources are available or where cooking demonstrations might be going on. And that might be an easier way for people in the community who need food assistance to kind of become familiar with resources. It's a little bit more of an informal, fun setting where people can learn about resources that are available to help them.
That's really valuable. And wherever we're practicing in Ohio, ohiofoodbanks.org, we can find what's available to us and our patients locally. Shifting to a broader lens, what interventions have shown the most promise for mitigating food insecurity's impact on diabetes and cardiovascular health? What's working in and for Ohio?
One thing that's working well is that local grocers and farmers markets have been accepting SNAP, and that's a good opportunity for people to get more fresh fruits and vegetables into their regular diets. Other incentives where you can use those SNAP benefits in grocery stores, so that's something that's specific to each community that would be going on there. 211 is a great resource across the state that can connect people not only to food resources, but a whole host of other drivers of food insecurity. So that's a wonderful resource that is available throughout the state. County health departments are another great resource and available statewide. So if people were to visit odh.ohio.gov, you can find more information about what's happening at your local health district. There are also a variety of free food websites that are out there that are searchable and let people find free food resources near them. So in addition to what's available through the Ohio Association of Food Banks, so you can visit freefood.org to find other food resources that are available. So there really are, I think, a lot of different resources going on that people can access to provide them with assistance in whatever area they might need it, not only food.
Yeah, Kristen, and another option that's growing across the country is medically tailored meal interventions. At the food bank, we're working on a pilot we've been developing, and we're planning to launch it this year. Basically, someone has a health condition with nutrition implications, again, like diabetes. We know what the best recommendations are regarding nutrition. So we've developed a menu of meals that are all tailored to their needs. And we are planning to deliver those on a weekly basis to patients. And they would get 10 meals a week. They'd be frozen so they can reheat them when they're ready. This is part of a growing trend. And there's been a growing body of evidence forming that's showing the promise of these kind of interventions.
That's an absolutely incredible project. So tell me more about that evidence. What's it showing? Is it costing too much money or is it really helping?
Yeah, Austin, I got some numbers here. MTMs, medically tailored meals, have been shown to lower emergency department visit rates by 70%, inpatient admission rates by 52%, and emergency transportation rates by 72%. I know money is often what's driving decision-making with organizations. So there's a study that found $220 per person per month savings with a MTM intervention. That's removing the cost of that intervention. So that's a good return on investment if you want to look at it from that perspective.
I'm blown away by that. I'm excited to see the results of your particular project. Well, even with such MTM options and other local availabilities, I know some patients still just aren't going to follow through with our recommendations. What barriers or what stigma do you think clinicians really need to keep in mind when we're addressing these topics?
I think at the top, you have awareness, raising awareness, because many people simply may not know about what kind of food resources are available to them, what they qualify for. Another classic barrier is transportation. If somebody is homebound, they may not be able to get to a food pantry or a hot meal. Another consideration, which can be a barrier, is culturally informed services. We want everybody to be able to find at least one meal on that menu that is going to really resonate with their family's idea of comfort food. One more, I guess, getting back to barriers, stigma, because that's still a problem. We've even noticed in rural areas, I think there tends to be a higher level of stigma, meaning people seem to be more concerned and thus reluctant to accept help or even ask for help when it comes to like food resources, because people are concerned about what are my neighbors going to think if I can't do for myself.
For sure, for sure. And how would you recommend we discuss this topic with patients? What's an effective way to break through some of that stigma?
Yeah, so as Eric mentioned, it can be difficult for people to ask for help. So I think it's important that clinicians approach the situation as empathetically as possible and really try to use non judgmental language when discussing food resources and food insecurity. So, as an example, instead of saying something along the lines of, I imagine you can't afford healthy food and you need help, maybe approach it as many people find it challenging to access healthy food sometimes, but there are a lot of local resources that can make it easier. Would you be interested in learning about some of these resources? Kind of get the consent from the patient that yes, like they do want help and they do want to know what some of those resources might be. Approaching it that way, I think, might go further with the patient. And then also to remember that this is likely going to be an ongoing conversation. So maybe you provide resources one time as a clinician, and then you see your patient a little bit later and they didn't go. As Eric mentioned, there's a lot of different reasons why people might not access food resources the first time they're presented with those options. But I think just continuing to have the conversation and to let people know that it's okay if they need help. That's why food banks and food pantries and produce distributions and all the organizations that we work with are there to help.
That is really helpful and very practical. And thanks to you both for all of the knowledge you're sharing today. It's actually informing and changing my own practice. And I know it's going to help my patients. And I can't imagine how many countless others throughout Ohio are going to be served by the information that you both shared with us. So it's very, very helpful. Kristen, how would you summarize the key points of what we just discussed?
Yeah, so I think listening for me today, the things that I would take away are that screening is very helpful. So Eric talked about that 2 item hunger vital sign in the beginning. I think it's really important to know who doesn't have access to food, who worries about where they're going to find their next meal from. So just knowing that is the important first step. So I would say one would be that screening. Second, collaboration matters. Nobody has to do this alone. Food banks work with a network of hundreds of partners, libraries, faith based organizations, schools, rec departments, health departments, hospital systems, a variety of medical providers, federally qualified healthcare centers. So there are lots of people working on this together. So kind of get to know who those people are and who those organizations are in your community and see how you can collaborate together. And then also, Eric talked a lot about the food as medicine approach. It's not just food security anymore that people are talking about, but really nutrition security. What is the food that people are getting access to, and how can that improve their nutritional intake in addition to just having food to eat? And new programs like medically tailored meals that are starting around across the country are becoming really important, and making sure that the food that's being offered is culturally appropriate so that people feel like there's something that's available for them to help improve their diabetes and cardiovascular outcomes.
Again, we appreciate you both joining us, shedding light on how we as clinicians and our communities can tackle food insecurity head on. For more information and for the resources on addressing food insecurity and improving diabetes and cardiovascular outcomes, please visit the Cardio website at cardio.org.
Thanks for having us, Austin. I hope this conversation motivates clinicians to reach out and form local partnerships.
Thanks for having this conversation today.
Thanks again to you both, and a special thank you to you, our listeners, for tuning in to Cardio Radio.
This concludes today's podcast. Be sure to visit cardio.org to learn more about the Ohio Cardiovascular and Diabetes Health Collaborative.